everybody.
Yeah.
As you are aware, the early intervention team works with young people who are experiencing their first psychotic episode. Psychosis is a debilitating condition which has its onset usually sometime between adolescence and emerging adulthood. In psychosis, sufferers often hear distressing voices or have unusual, persecutory or frightening beliefs. Because of the typically young age of onset, psychosis can be particularly difficult, with far-reaching implications for the individual and their families. All aspects of their life can be affected, including education, employment, relationships and social functioning. In fact, the World Health Organization calculated that, at a family level, the burden and human suffering caused by psychosis was exceeded only by quadriplegia and dementia. This group not only experiences stressful and frightening symptoms, social isolation and stigma, but life expectancy is reduced by about 16 to 25 years from a combination of suicide, high rates of drug use and high rates of premature cardiovascular disease. This is also often due to poor nutritional advice, high doses of medication and unhealthy lifestyles. But it is not all bad news, yay! Early intervention in psychosis has shown to dramatically improve outcomes, to more than halve suicide, to increase employment, to increase social connections and to give people hope for the future rather than the bleak messages that they had received previously. The sooner people get help, the better the outcomes. And so we aim to actively engage with young people early and maintain our engagement throughout their critical period. As you may imagine, young people with mental health problems, poor social networks and substance use are difficult to engage, particularly as some traditional mental health services can be seen as stigmatising. We look to creatively engage with our young people in as many ways as we can, through the use of sport, football, coffee, meeting up in non-stigmatising settings and increased social interaction. This allotment project and Walk, Talk and Grow is funded by a charity bid that we applied for and got for £6,500. In it we aim to promote walking. There's a series of different walks of varying difficulty, talking and growing to young people. We want young people to understand about healthy eating. We're aiming to employ a dietitian one day a week, to take pride in growing their own food and to learn to cook it rather than being entirely reliant on takeaway food. We've secured 2 allotments, this one in Corringham and another one in Southend, and we work to specifically learn about food, healthy eating, and for young people to understand their role in preventing obesity and cardiovascular disease and reducing the trend of reduced life expectancy. Finally, we hope that we can help anybody who's struggling to connect to their peers to reach out and connect with us and other young people. We hope that this project will become fully sustained, driven and further developed by the young people themselves. Thank you.
Thank you.